Budesonide, a synthetic corticosteroid, has gained widespread recognition for its potent anti-inflammatory properties. Developed in the 1970s, this medication has become a valuable tool in the treatment of various respiratory and gastrointestinal conditions. In this comprehensive video, I will delve into the world of budesonide, exploring its typical uses, advantages, potential side effects, dosage recommendations, and the precautions one must take when using this powerful drug. Budesonide belongs to the class of medications known as glucocorticoids, which mimic the effects of naturally occurring hormones produced by the adrenal glands. These synthetic compounds are designed to reduce inflammation and suppress the immune system, making them effective in managing a wide range of inflammatory and autoimmune disorders. As we embark on this journey, I will shed light on the diverse applications of budesonide, its mechanisms of action, and the factors that contribute to its effectiveness. From respiratory ailments to gastrointestinal disorders, we will explore the versatility of this medication and its impact on improving the quality of life for countless individuals worldwide. Typical uses of budesonide. Budesonide finds its primary application in the management of respiratory conditions, particularly asthma and chronic obstructive pulmonary disease, COPD. When administered via inhalation, budesonide works by reducing inflammation in the airways, alleviating symptoms such as wheezing, shortness of breath, and coughing. Asthma. Budesonide is widely prescribed as a maintenance therapy for individuals with persistent asthma. By reducing airway inflammation, it helps control asthma symptoms and prevent exacerbations, allowing patients to breathe more easily and engage in daily activities without significant limitations. Chronic obstructive pulmonary disease, COPD. In addition to its use in asthma, budesonide is also employed in the treatment of COPD, a progressive lung condition characterized by airflow obstruction and chronic inflammation. When combined with bronchodilators, budesonide can help alleviate symptoms and improve lung function in COPD patients. Nasal polyps and allergic rhinitis. Budesonide is available in the form of nasal sprays, making it an effective treatment option for conditions such as nasal polyps and allergic rhinitis. By reducing inflammation in the nasal passages, it can alleviate symptoms like congestion, runny nose, and sinus pressure. However, the applications of budesonide extend beyond respiratory conditions. This versatile medication has also proven beneficial in the management of certain gastrointestinal disorders, particularly inflammatory bowel diseases, IBD, like Crohn's disease and ulcerative colitis. Advantages of using budesonide. Budesonide offers several advantages that contribute to its widespread use and popularity among healthcare professionals and patients alike. High potency and targeted action. Budesonide is a highly potent corticosteroid, capable of delivering powerful anti-inflammatory effects while minimizing systemic exposure. This is achieved through its targeted delivery to the affected areas, such as the lungs or the gastrointestinal tract, reducing the risk of systemic side effects. Improved quality of life. By effectively managing respiratory and gastrointestinal conditions, budesonide can significantly improve the quality of life for patients. Reduced inflammation and alleviated symptoms allow individuals to breathe more easily, experience less discomfort, and engage in daily activities without substantial limitations. Long-term management. Budesonide is often prescribed for long-term use, enabling patients to maintain control over chronic conditions like asthma, COPD, and inflammatory bowel diseases. Its favorable safety profile and targeted delivery make it a suitable choice for prolonged treatment regimens. Versatile administration routes. Budesonide is available in various formulations, including inhalers, nasal sprays, and oral preparations, allowing for tailored treatment approaches based on the specific condition and patient needs. Potential side effects of budesonide. While budesonide is generally well tolerated, like any medication, it can potentially cause side effects. It is crucial to be aware of these potential adverse effects and discuss them with a healthcare professional. Local side effects. Depending on the route of administration, local side effects may occur. For inhaled budesonide, these can include oral thrush, a fungal infection in the mouth, hoarseness, and throat irritation. With nasal sprays, nasal dryness, nosebleeds, and nasal irritation may be experienced. Systemic side effects. Although systemic side effects are less common with budesonide due to its targeted delivery, they can still occur, especially with prolonged use or high doses. These may include adrenal suppression, growth suppression in children, increased risk of infections, and thinning of the bones, osteoporosis. Behavioral and mood changes. In rare cases, Budesonide may cause mood disturbances, such as irritability, anxiety, or depression, particularly in individuals with a history of mental health issues. Allergic reactions. While uncommon, some individuals may experience allergic reactions to budesonide, such as rash, itching, or difficulty breathing. It is essential to report any concerning side effects to a healthcare professional promptly. They may adjust the dosage or consider alternative treatment options to minimize the risk of adverse effects. Dosage recommendations for budesonide. The appropriate dosage of budesonide varies depending on the condition being treated, the severity of the condition, and the individual's response to the medication. Healthcare professionals carefully determine the optimal dosage based on several factors. Asthma and COPD. For the management of asthma and COPD, budesonide is typically administered via inhalation using a metered dose inhaler or dry powder inhaler. The dosage may range from 200 to 800 micrograms per day, divided into 2 or 4 doses, depending on the severity of the condition. Nasal polyps and allergic rhinitis. For nasal conditions, budesonide is available as a nasal spray. The recommended dosage for nasal polyps is typically 2 sprays, 64 micrograms per spray, in each nostril once or twice daily. For allergic rhinitis, the dosage may range from 1 to 4 sprays per nostril once or twice daily. Inflammatory bowel diseases. In the treatment of Crohn's disease and ulcerative colitis, budesonide is administered orally in the form of capsules or extended-release tablets. The dosage may vary from 9 to 18 milligrams per day, depending on the specific condition and the patient's response. It is crucial to follow the dosage instructions provided by the healthcare professional and not to adjust the dosage without consulting them first. Adhering to the prescribed dosage and administration schedule is essential for achieving optimal therapeutic effects while minimizing the risk of side effects. Dangers and precautions of using budesonide. While budesonide is generally considered safe when used as directed, there are certain dangers and precautions to be aware of. Adrenal suppression. Prolonged use of budesonide, particularly at high doses, can lead to adrenal suppression, where the body's natural production of cortisol, a hormone produced by the adrenal glands, is reduced. This can result in fatigue, weakness, and an increased risk of infections. Growth suppression in children. Budesonide, like other corticosteroids, may potentially interfere with normal growth and development in children. Healthcare professionals closely monitor the growth of children receiving long-term budesonide treatment. Interactions with other medications. Budesonide can interact with certain medications, such as antifungal drugs, HIV protease inhibitors, and certain antibiotics. It is essential to inform the healthcare professional about all medications being taken to avoid potential interactions. Pregnancy and breastfeeding. The use of budesonide during pregnancy should be carefully evaluated, as it may potentially affect the developing fetus. Additionally, it is not known whether budesonide passes into breast milk, so caution should be exercised when breastfeeding. Underlying medical conditions. Individuals with certain medical conditions, such as diabetes, hypertension, or osteoporosis, may require closer monitoring and dosage adjustments when taking budesonide. It is crucial to discuss all potential risks and precautions with a healthcare professional before starting budesonide treatment. They will weigh the benefits against the potential risks and provide guidance on how to safely use the medication. Comparison of budesonide with other similar medications. Budesonide belongs to the class of inhaled corticosteroids, ICS, which also includes medications like fluticasone, beclomethasone, and mometasone. While these medications share similar mechanisms of action and therapeutic uses, there are some key differences. Potency. Budesonide is considered a potent ICS, with a higher anti-inflammatory potency compared to some other ICS medications. This means that lower doses of budesonide may be required to achieve similar therapeutic effects. Systemic exposure. Budesonide is designed to have a low systemic bioavailability, meaning that less of the medication is absorbed into the bloodstream. This reduces the risk of systemic side effects compared to other ICS medications with higher systemic exposure. Metabolism. Budesonide undergoes extensive first-pass metabolism in the liver, further limiting its systemic exposure and potential for systemic side effects. Formulations. While most ICS medications are available as inhalers, budesonide is also available in nasal spray and oral formulations, allowing for targeted treatment of various conditions. It is important to note that the choice of medication depends on several factors, including the specific condition being treated, the patient's individual response, and the healthcare professional's clinical judgment. In some cases, a combination of different ICS medications or the addition of other therapeutic agents may be recommended for optimal management of respiratory or gastrointestinal conditions. Budesonide for different medical conditions. While budesonide is primarily known for its use in respiratory and gastrointestinal conditions, its anti-inflammatory properties have made it a valuable treatment option for various other medical conditions as well. Eosinophilic esophagitis. Budesonide has shown promising results in the management of eosinophilic esophagitis, a chronic immune-mediated condition characterized by inflammation and accumulation of eosinophils, a type of white blood cell, in the esophagus. Microscopic colitis. In cases of microscopic colitis, a condition characterized by inflammation of the colon, budesonide has been used as a treatment option to alleviate symptoms such as diarrhea and abdominal pain. Autoimmune hepatitis. Budesonide has been explored as a potential treatment for autoimmune hepatitis, a chronic liver disease caused by an autoimmune reaction against liver cells. Inflammatory skin conditions. Topical formulations of budesonide have been investigated for the treatment of various inflammatory skin conditions, such as atopic dermatitis and psoriasis, due to its anti-inflammatory properties. It is important to note that the use of budesonide for these conditions may be off-label or investigational, and further research is ongoing to establish its safety and efficacy in these areas. Healthcare professionals carefully evaluate the potential benefits and risks before prescribing budesonide for conditions beyond its approved indications. Budesonide in different forms, inhalers, nasal sprays, etc. Budesonide is available in various formulations to accommodate different routes of administration and target specific conditions. Inhalers. Budesonide is commonly administered via inhalation for the management of respiratory conditions like asthma and COPD. Inhalers come in different forms, including metered dose inhalers, MDIs. These inhalers deliver a measured dose of budesonide with each actuation. Dry powder inhalers, DPIs. These devices contain budesonide in a dry powder form, which is dispersed into a fine aerosol during inhalation. Nasal sprays. For the treatment of nasal polyps and allergic rhinitis, budesonide is available as a nasal spray. The medication is delivered directly to the nasal passages, providing targeted relief from inflammation and congestion. Oral formulations. Budesonide is also available in oral formulations, such as capsules and extended-release tablets, for the treatment of inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Topical formulations. In some cases, budesonide may be formulated as a topical cream or ointment for the treatment of certain skin conditions, although this is less common than other routes of administration. The choice of formulation depends on the specific condition being treated, the desired site of action, and the patient's preference and ability to use a particular delivery method. Healthcare professionals carefully consider these factors when prescribing budesonide to ensure optimal treatment outcomes. Conclusion and final thoughts on budesonide's uses and effectiveness. Budesonide has emerged as a versatile and invaluable medication in the management of various inflammatory conditions, particularly those affecting the respiratory and gastrointestinal systems. Its potent anti-inflammatory properties, targeted delivery, and favorable safety profile have made it a preferred choice among healthcare professionals and patients alike. Throughout this comprehensive video, we have explored the diverse applications of budesonide, from its primary use in asthma and COPD to its role in managing nasal polyps, allergic rhinitis, and inflammatory bowel diseases. We have delved into the advantages of using budesonide, including its high potency, targeted action, and ability to improve quality of life for patients suffering from chronic conditions. While budesonide is generally well tolerated, we have also addressed the potential side effects and precautions that must be considered. It is crucial to follow dosage recommendations and consult with healthcare professionals to ensure safe and effective use of this medication. By comparing budesonide with other similar medications, we have highlighted its unique characteristics, such as its low systemic exposure and extensive first-pass metabolism, which contribute to its favorable safety profile. Furthermore, we have explored the various formulations of budesonide, including inhalers, nasal sprays, and oral preparations, allowing for tailored treatment approaches based on the specific condition and patient needs. As we conclude our journey through the world of budesonide, it is evident that this medication has revolutionized the management of inflammatory conditions, offering relief and improved quality of life to countless individuals worldwide. However, it is essential to remember that budesonide should be used under the guidance of healthcare professionals, who can carefully evaluate individual circumstances and ensure its safe and effective use. If you or a loved one are struggling with respiratory or gastrointestinal conditions, or any other inflammatory disorder, we encourage you to consult with a healthcare professional to explore the potential benefits of budesonide. With their expertise and guidance, you can determine if this medication is the right choice for your specific needs and develop a comprehensive treatment plan tailored to your individual circumstances.